Welcome to the University of Arkansas Benefits by Topic series for benefits-eligible employees. Benefits-eligible employees are those who are appointed at least 50% or more in a non-student role and work approximately 20 hours or more per week. Let's take a look at the university's flexible spending accounts and healthcare savings account. Flex accounts allow you to deposit pre-tax money for this year to cover health or dependent care costs. You must use it or lose it. Health savings accounts are pre-tax dollars for health expenses this year, and the value carries over year to year, and you take it with you when you leave the university. You must be enrolled in the health savings plan to start a health savings account. Let's look closer at these two types of accounts. Flexible spending accounts allow you to pay for qualified out-of-pocket medical and/or child care expenses on a pre-tax basis. You can elect to participate in either or both the medical reimbursement or the dependent care. You will decide how much to set aside for the plan year to pay for qualified expenses. The money you designate will be taken out of your pay before taxes, thereby lowering the amount of income on your W-2 and helping you to pay lower income taxes. You will incur qualified expenses during the plan year and file for reimbursement. Medical participants can use a debit card issued by UMR. You will need to save copies of receipts and paperwork that you need to send to the FSA Administrator, UMR. You will have until March 31st of the new year after the plan year ends to file claims for reimbursement. If there is any money left in your dependent care account after the eligibility dates, it will be forfeited. There is a $500 rollover limit on the medical flexible spending account. You must re-enroll every year during open enrollment. Dependent care flexible spending accounts are used for reimbursement for care of dependent children under the age of 13 by babysitters, nursery schools, preschools, or after-school programs. They can also be used for care of an adult member of the household who is physically or mentally incapable of caring for themselves and for who you can claim as an exemption on your taxes. Medical flexible spending accounts can be used for office visits, prescription copays, insurance deductibles, glasses, contact lenses, dental care, or other medical needs for you and your dependents. The minimum contribution on both the dependent and medical flexible spending account is $120 per year. The maximum contribution on the dependent care account is $5,000 per plan year, or $2,500 if you are married and filing separately. There is no debit card for the dependent care account. The maximum amount for plan year 2019 for the medical flexible spending account is $2,650. Healthcare participants will receive a debit card. You can find a full list of expenses on IRS Publication 502 at irs.gov. In order to enroll in a health savings account, you must be enrolled in a health savings plan. Employees who participate in the Classic or Premier plan or who do not participate at all in the University of Arkansas insurance can participate in the flexible medical spending account. You cannot participate in the health savings account if you or your spouse participate in a flexible spending account or other health reimbursement account in the same year that you participate in a health savings account. If you're enrolled in Medicare, TRICARE, or have received VA health benefits in the 3 months prior to enrollment in a health savings account, or you are claimed as a dependent by someone else. If you sign up for the health savings plan, you should consider using some of your premium savings to contribute to the health savings account and build up your balance to cover the higher out-of-pocket costs. Remember, you keep your health savings account even when you leave the University of Arkansas employment. Let's look at the differences in the flexible spending and the health savings account. The contribution limits for 2019 for the flexible spending account are $2,650. The health savings account individual contribution limit for 2019 is $3,500. The family limit is $7,000. And if you are 55 or older, you can contribute an additional $1,000 as a catch-up. This includes your employer and personal contributions. You can contribute to both accounts through payroll deduction. For the health savings account, you may also contribute outside of payroll. Others may contribute to your account, and contributions can come from other sources subject to the maximums. There is a $50 minimum rollover up to $500 maximum rollover in the flexible spending account, and any amount can roll over in your health savings account from year to year. The University of Arkansas owns your flexible spending account, so any unused amount will be forfeited if you leave university employment. You own your health savings account, so you take that with you when you leave employment. You have access to any of your annual contribution on your flexible spending account at any time, but on your health savings account, you only have access to the funds that are deposited in your account. Your flexible spending account only grows by your contributions. However, your health savings account can grow by your contributions, your University of Arkansas contributions, any funds that you have transferred from another health savings account, interest, and investment income. You must file any eligible reimbursements from your flexible spending account by March 31st of the following plan year. You may file for reimbursements anytime for a health savings account from the time you enroll. Flex spending account can only be used for reimbursements for healthcare expenses. Health savings account you can use for things other than healthcare expenses, but you will be subject to a tax penalty. If you are under age 65, you will be charged regular payroll taxes plus a 20% tax penalty. If you are over age 65, there is no tax penalty, but you will be subject to regular income taxes. Again, you can find eligible expenses for both accounts on the irs.gov website. Remember, you must enroll in your benefits within 31 days of your benefits eligible or qualifying event date. There are no pre-existing condition exclusions and no lifetime maximum benefits. Rates vary between 9 and 12-month appointed employees as well as pay range. Insurance cards can take up to 4 weeks to process and arrive in the mail. Fall open enrollment allows you to change enrolled plans or to add a plan for the coming year. You can also change to and from before and after tax premiums or add and delete dependents from your current plans. For questions, please email us at hrbenf@uark.edu or call us at 479-575-5351. Thank you for attending the University of Arkansas's Virtual Benefits Orientation.